It's my pleasure to welcome all of us to the third African Youth SDG Summit on the theme Securing the 2030 Commitment Beyond the COVID-19 Crisis or Era. So this morning we are starting off with an early morning session. There is a session that is going to take off now prior to the official opening of the summit. So if you would notice, or if you're viewing us on Facebook Live, we want you to know that the official opening ceremony is going to be starting at 12 noon today, Ghana time. But we're going to have a session now. It's a plenary session that is going to be discussing building sustainable public health systems after COVID-19, what the role young people can play towards sustainable health systems. And it's my privilege to introduce the moderator of that session, who is Ms. Regina Fuller, a doctoral candidate in educational policy studies at the University of Wisconsin-Madison in the United States. So, Regina, please, if you're ready, take the floor.
Good morning, everyone. I would like to welcome my panelists, my speakers today. We have Dr. Adriana Awog-Badek. She's a medical doctor at Greater Accra Regional Hospital and also the president of the Foundation for Universal Healthcare. Our second person in person today, Dr. Samuel Ofosu Agama. He's a medical doctor at Kolebu Teaching Hospital. And then our third person who is present with us in Accra today is Dr. Florence Akumia. She's the General Secretary for the Association of Doctors and Residents. Let's please welcome them. I would also like to acknowledge we will have two other presenters joining us remotely via Zoom. That is Dr. Esther Muya. She is the UNFPA country representative for Zimbabwe. Emmanuel Lobijo, he's the executive director for Open Space Uganda. And then we'll have a video message from Dr. Shakira Shunyada. She's a member of the African Union Youth Council. So it's time to address the elephant in the room. COVID-19 has reshaped the planet, devastated communities, and burdened public health. Yet, in addition to tackling today's crisis, we need to prepare Africa's medical infrastructure for the next one. That means closing some of the widest geographic and economic gaps in access in the world and engaging young people to serve a historically expanding population. This panel presentation today will explore health geographies, inequalities, and the role of young people in building a lasting talent and resource pipeline for a healthier 21st century. So on format, I have a couple of guiding questions for our panelists today, and then I will open it up for all of you here in person in the room to ask questions, and I will also open it up for questions from Facebook and Zoom. So the first question for the panelists: what are the biggest inequities in health access, and what decisions can close them?
Good morning to you all. Inequities are the disparities in access to healthcare as a result of differences in certain demographic factors, such as your race, your ethnicity, your gender, whether you are disabled or not, your socioeconomic background. And so for me, the biggest inequity, the people who suffer the most, the people who are most disadvantaged are the poor, they are people of color, they are women, they are disabled people, they are people in the LGBT communities, and people in the global south and rural areas. So those are the people who are most disadvantaged with regards to access to healthcare. And to close this gap, I believe you can't just set up hospitals and expect, in our part of the world, it's not everybody who can afford healthcare. So I believe we should set up, first of all, health insurance coverage for the population. Apart from that, but health insurance alone would not solve our issues. We have to solve the grassroots problem, which is solving the social factors. So with regards to we have to address socioeconomic issues like which neighborhoods do the people live in, what is their level of education, what work do they do. Our healthcare starts in our homes. It starts in our schools, in our workplaces. And we have to attack these issues. With regards to that, we would have to ensure that there's affordable housing for our people. There's safety of neighborhoods. That we should curb environmental pollution. With regards to education, it is important that we give good quality education for our children. With regards to our workplaces, we have to ensure that there are good employment opportunities for everybody and that people can have a decent income. There should be movement. We should support movements for social justice. If there are people who are being discriminated against, we should all come together and curb this. We should also ensure that there's quality of service in our healthcare industry. So to me, these are the ways in which we can close the gaps in with regards to access in healthcare.
Thank you.
Okay, thank you very much. So I would say that COVID-19 has exposed key deficits or deficiencies when it comes to healthcare in Africa. And then one of that was our public health emergency response that was very frail from the beginning. You realize that there were a lot of plans, considerations when it came to healthcare. And that even led to the formation of the African CDC. But key projects or policies were not put in place to be able to curb the insurgence of diseases when it came to Africa. Because we were looking at looming pandemics or epidemics even before COVID-19 came. We're looking at Lassa fever, Ebola outbreak in DRC. These were key diseases that have attacked our continent in the past. So we could have put in key measures when it came to COVID-19 to be able to prevent the diseases. Now, we didn't do that. We realized that African CDC was formed. The decentralization process was poor. Excuse me to use that word, was poor, because the establishment of the biosafety level laboratories was not done. So if we had these things in place, you will see that our response to COVID-19 would have been much more broader and much bigger than we thought. Now, coming back to the local countries, we will realize that there's lack of human resource. Now, in this particular field, I will not speak only about the medical doctors, but the allied health. Now, we have poor disease control officers system. We don't have enough people who do education. The IPC, infection and prevention controls, are not in place. In as much as that, we also have infrastructural deficit that has existed in Africa, and especially in the low to middle income countries like ours. So these are key deficits we can identify when it came to COVID-19. Now, breaching that gap means that extensive policy formulation and then implementation. And that's one thing we lack when it comes to our setting. We are able to sit at the table, put in policies, but when it comes to the deployment onto the field, we realize that our response is very limited. And that's one thing we need to do going forward, that COVID-19 has brought us the idea or exposed these differences and inequalities that we had. And we can capitalize on it and build a more resilient public health system. So going forward, we need to look at the inequalities from the continental level to the national level and then to the sub-regional and district level. And this, we need everyone on board. And I think that's where the youth come in. That is where our role and efforts or functions will come into play. Okay, so going forward in the panel, I think we'll come to that and then we'll be able to speak more on what the youth can do in the healthcare. Thank you.
Thank you. Thank you.
So I totally agree with what Senor said, especially about the implementation of policies. That's one area where we are lagging. There are a lot of policies, but you only realize that the policies are there when you want to research into it, what can we do? Then you realize that there's already a laid out plan as to what should be put in place. There's a local study that assessed our response to influenza, made recommendations of our preparedness for it, but nothing was implemented till we got this COVID outbreak. So it's one of the things that we should look at. Also, you'd realize that health literacy is also a major problem. Our understanding of health matters are clouded by myths and social misconceptions and sometimes religious beliefs. So it makes it very hard for people to accept, assimilate, and even apply the various health prevention and protective measures that you may be telling them about. So it's also one aspect where we should really address health literacy of the populace.
Thank you all. I want to ask a follow-up question since we are at the African Youth SDG Summit. What have you seen has been the impact on COVID-19 on African youth? My area is sexual and reproductive health, and I've read a lot about how young people have lacked in access. So how would you see that young people, particularly within the continent, have been impacted by COVID-19?
So I think most of the young people are students. And one major area that was affected by the COVID was education, because schools had to be closed down. Those that had the capacity reverted to online learning, but then accessibility by the bigger population of the students was also a problem or a contention. So it's one of the things that has really been impacted by the COVID. Education, tertiary, primary, secondary level were all affected.
Anyone else? How have you seen young people's health, even in your own practices? How have young people's health within Accra and Ghana been impacted by COVID-19?
Okay, unfortunately, the COVID-19 pandemic, which caused lockdowns, forced a lot of people to stay at home, and this unfortunately forced a lot of victims of abuse to be locked down with their abusers. So it increased incidences of people being beat up, people who are victims of sexual abuse. The incidences increased. The number of times they were abused increased. And they can't go out, they can't report to anybody because they are locked down with their abusers. So this is one of the ways in which in the hospitals the number of cases increased.
Okay, just to add to that, another point was the economy. The way the economy was affected by COVID-19, it also reflected on the health of people. Because when you look at the health of someone, it's not only just the physical and well-being, but we are looking at the social well-being, we are looking at the other factors like the economic conditions that also affect the health of people. And this is one thing that really caused the conditions of life and health of people to be deteriorated during the COVID-19. So I'll just add this for now.
Okay, thank you.
And I also think that, unfortunately, the poor and marginalized were the most affected in all this. Their access to health care, there are a lot of students from low socio-economic backgrounds couldn't access the Zoom classes that were being organized.
Okay, so I also wanted to comment that the initial response to the pandemic was to close down certain aspects of health care service. So this also affects a lot of people because some routine or chronic medical conditions that patients would have reported to facilities for could not be accessed. And then also family planning services. Like we brought down things to the level of emergency care service only. So that's how one of the ways it affected the health of young people too.
All right, thank you. We have Dr. Esmuya, who's the UNFPA country representative in Zimbabwe. She's on Zoom. Doctor, would you like to say something about the impact of COVID-19, which you've seen in Zimbabwe in your country office on young people? Okay. All right, we'll come back to you. All right, so the next question, I think a couple of our panelists brought up the gap between policy formulation and implementation in young people. So the next question, how do we best support young people both in pursuing health careers, and how can they work with leaders to actually implement some of these policies that have already been created on healthcare in Africa or public health in Africa?
Well, I believe that in many parts of the world, countries are struggling with imbalanced doctor or nurse to patient ratios, with just very few medical practitioners having to serve huge populations. We, the youth, are the strong working force who can actually, who need to learn from and eventually replace the old doctors, the nurses, the medical administrators, the laboratory technicians. We are the people who should do that. But unfortunately, many of you don't want to enter into careers within healthcare because the process is just is troublesome. So I believe that the stakeholders, the regulatory bodies in healthcare, in health education, should make the process fair and transparent without having to compromise quality. They should remove the unnecessary hurdles involved in the training of students. There are many cases where in education, the literature is outdated. Students have to struggle. The books given to them are not up to date. They have to go and look for a lot of other material. They don't have equipment, the equipment they need to learn. So I believe it is important we address all these issues. Government can also subsidize some of for the education of people within the healthcare system.
So I think that when we consider healthcare careers, we should broaden our scope beyond the doctor and the nurse and the lab technicians. There's so much in the health industry that you realize that maybe you can go into biomedical engineering, pharmacy, you can go into production of medications. One of the major challenges we faced was availability of personal protective equipment during the COVID-19. And this was a pandemic. Every country was rushing for some. So if you produce it locally, you have an upper hand. So I think we should look at it as a broad scope, all the career options available, and let's move into those fields, as opposed to being single-minded about becoming a doctor. There are other ways we can, as youth, help with the healthcare system.
To add to what she said, it is very important we invest into research within healthcare, because especially we Africans, we know our people best. We can't always sit down and wait for people from the West to come and say, okay, I've studied your people. This is how you react to this disease. This is black people shouldn't take this medication. This is how the Ghanaian demographic works. No, we know our people best. We should do our own research and come up with innovative solutions to our own problems.
Okay, so when it comes to youth and their participation in health, one question I always ask is this: are we ready to actively participate in our health? Now, there are a lot of things that we could do. When you look at health, we don't only have to concentrate on the hospital setting. There was one concept that was more developed when it came to COVID-19, and that was telemedicine. You realize that telemedicine play a vital role in the education of the population in every country. And Ghana was also privileged to have some of these resources. Now, medicine and health is a two-way process. The doctor needs to know about the health of the patient as well as the patient needs to know. So we need to engage in an active education process. And that is where medicine is not only taught in schools or medical schools. You can learn about your own health wherever you are. And so if we can do this and then spread the word and teach people, we realize that the youth can actively participate when it comes to the health process. So I will speak to telemedicine, I'll speak to the allied health. We are looking at disease prevention. We are looking at public health, education, and other sectors of the health that are not only based in the hospitals. If we can really put all this together with telemedicine, with other innovations when it comes to health technology, you realize that during the COVID period, I read a note from the Ghana Statistical Service, and they even use our mobile data or our mobile phone data to be able to trace population displacement. And that was able to inform policies when it came to health. So youth can engage in technology in medicine, not only in coming to learn about pharmacy or coming to learn about being a doctor, but also engage in the periphery when it comes to healthcare. And I think that would be very helpful for us.
Thank you. We're going to pause for a moment. We have a video for someone who is not with us in person today from Dr. Shakira Shunyata. She's a member of the African Union Youth Council.
I'm so delighted to check in with so many of you, and I wish that, this didn't have to be pre-recorded, but I guess the saying goes that life happens. And I don't know if the organizers will play this at the beginning of the panel or at the end of the panel, but either way, I hope that what I say today elicits real, truthful, robust discussions about this continent, COVID-19, and young healthcare professionals. But I think it's not just young health professionals I'm chatting to this morning or today. It's really essentially young people in general, and how it's going to be up to us to actually shape what's going on at the moment. And I think, I started off at the beginning of the pandemic slightly hopeful, and now a few months later saying that I'm less hopeful. And I think we have our work cut out for us. And the reason I say this is because, this pandemic really presented opportunities. And for those of you who are in health or not in health, you may have heard of the social determinants of health. And I think, we've always centered our work around that in the public health space. And that's essentially your type of employment, your level of education, your type of residence, whether you have food or not, whether you have water or not, will determine your access to healthcare. And I think this pandemic brought it all to light on this continent. And there was an opportunity where we could have pushed long-term, sustained effort. But in a country such as South Africa, all the money meant for COVID-19, or a vast majority of it, went to corruption. And the story is probably not that different on the rest of the African continent. And so when we're talking about inequalities and inequities, let's put it into real perspective. What exactly are we saying? I found it very distasteful from the beginning of the pandemic up until now to see so-called leaders posting videos on how to wash hands. And I think washing hands is an important public health measure, don't get me wrong. But what I found distasteful is that you're posting videos to a population on this continent that does not have access to water, or at least a vast majority. And so any money that we were using, directing, borrowing, resources allocated, should have went to long-term sustained efforts. Let's put water in our communities. That could have been a success story of COVID-19. It's not yet. And then we also look at other issues, for example, the inequalities and inequities that were deepened during this crisis. We're looking at a world going extremely digital. Many of us have been fortunate to be digital even before this pandemic. But what we're seeing is a continent affected by the lack of electricity infrastructure and the lack of internet infrastructure. And this pandemic, we have definitely left many people and young people behind. So largely, besides private schools and universities and well-off schools and universities, people's education was disrupted, or is and continues to be disrupted. And what this means, and also if we look at the workplace, we're also seeing disruptions there. So what we could have done during this pandemic is start to put in place key demands for our government as young people. and this is linked to health, the social determinants of health, that we simply have to push a lot more for. That is the access to water, that is the access to education. But to do that, we need to solve systemic issues, give us the infrastructure, and I think we can't shy away from this anymore as young people. And I hope that in this conference we start to talk about it a lot more. Where did we go wrong, and what can we still do about it?
Thank you. So going back, I think Dr. Shinyar raised some excellent points, and it fits in well with the conversation we're having today. Dr. Ofosu, you had mentioned thinking more broadly about careers in health and medicine, in public health, outside of just being a doctor, and I think a lot of you all mentioned that. So what are some of the skills that young people need to enter into this space in public health, whether it's as a doctor, whether it's as an engineer making PPE, whether it's as a program manager, maybe running a program on sexual and reproductive health? What are some of the top 3 skills you think young people need to have to enter this space and be successful?
So I think the number one need is the motivation. If you have the right motivation and you want to participate in that particular sector, that will work. Now, the other thing is to have the basics when it comes to healthcare. And as I said earlier, we don't need to be in the school to know about your hypertension or diabetes or these basic diseases. You can read about them and then consult a health professional. Now, from there, you need to have the ability to go to school, have the opportunities, the infrastructure development. We need that as well. We need to have government policies that create access to healthcare. Now, there's a lot of means we can use, online modules of learning, online modules that we can employ the youth to take up courses in that regard. Now, on the other hand, the youth needs to identify the need when it comes to healthcare in their communities. If we're able to do a proper needs assessment, determine where and what are the peculiar problems we have in our society, and then from there we take the initiative to look for solutions to that need. And not only do you have to come to maybe go to an allied school like learn public health or learn infection prevention and control, learn emergency response, community health. Not only to do that, but from your field of study, whether business, whether law, anything, you can also employ health in your sector. So we need to look at a multi-sectorial partnership when it comes to the development of the youth in healthcare. And that's one thing I would like us to really focus on as youth and as stakeholders in our own future and our own health. We need multi-sectorial partnership.
Did either you want to add? No.
I was going to say that I believe that we can leverage the youth's interest in technology to improve healthcare. A lot of us, we are always looking for the newest phone, the newest smartwatch, and a lot of these are increasingly being used to track blood pressure, heart rate, respiratory rate. So I believe that we can leverage the. I'm pleading to the tech-savvy youth to come up with ways to bring this into healthcare, whether it's mobile application, whether it's machines, anything that we could use to improve our diagnosis and treatment. We can use it for e-consultations to improve our medical record system, because now we are increasingly moving from the traditional form to electronic medical record system. So yeah. Thank you.
Essentially, what I want to encourage the youth to do is to be more innovative. I think our education system makes us want to toe one line, go according to what has been done before. So we are not ready to think outside the box. We are not ready to be innovative, but we are at the point where we need innovation to solve our problems, because the Western world is way ahead of us. They've solved all their problems. I mean, the problems we are facing now, they have managed to solve for themselves. So if we want to solve our problems, we can't expect that they would be focused on how to solve our problems locally. So we need to look into innovative ways of solving our health problems, and like they all said, incorporate it into our various fields of professions, and that's going to help us a lot.
All right, thank you. I think you brought up an excellent point, and I think unfortunately, COVID-19 showed that whether we were in Ghana or in the U.S., where I'm from, that places that supposedly had great public health infrastructure, COVID-19 exposed a lot of the weaknesses. So what are the critical strengths and weaknesses in Africa's public health infrastructure, as we've just seen through COVID-19? And then how can young people address those weaknesses?
So I'd like to comment about the rural-urban divide in terms of the infrastructure. You realize that a lot of the rural areas still depend on CHIPS compound or very small health clinics. A lot of them that were co-opted as treatment centers did not even have the basic requirements to serve as treatment centers for such a communicable and infectious disease. So that's one of the major aspects. And as youth, we have people who are into building and technology. We have people who are medics. If we form multi-sectoral groups and establish health facilities that provide high-level standardized care in the rural areas, it would be a source of economic growth and also provision of or equitable healthcare infrastructure.
I believe one of the main problems we have, especially in our parts of the world, is health literacy. There are people who have been diagnosed with a certain disease. They don't even know what medications they are taking. They just take it. People don't even know the basics of prevention of disease. So I believe that it is important we emphasize on health literacy, whether we can add it to our educational curriculums. Teach them young, and they'll continue with those habits. Teach school children how to keep personal hygiene. Don't throw things, proper waste management. So we can start from that. We can also employ our mass media. We can use the media to educate people. It's not every day about telenovelas. Good health education should be incorporated into our media. We can use social media for health literacy. My organization, Foundation for Universal Healthcare, during the lockdowns, we realized that we couldn't go into the communities for health education. So what we did was we used our social media pages. Every day we'll select a topic and we'll explain to people the basics. On Twitter, people would ask us. There was an incident where 2 young men got kidney disease, and people were calling out. They don't understand why a lot of young people in Ghana are now all of a sudden getting kidney disease or liver disease. And we took our time. We explained to them the factors involved and everything. So I believe if we make health literacy if we make health literacy a priority, to go a long way to help improve our health system.
And just to add to that, I think one thing we should look up to is medical volunteerism. And that is one of the basic things we should do. And for now, because we are trying to build a resilient system, it means that we need volunteers when it comes to healthcare, and volunteers in the field of education, in the case of the health literacy, as my colleague just said. And if we can get medical volunteers who go into the communities, educate people, help to carry out extensive campaigns, for example, like blood donation exercises and other key medical screening projects. If we can have youth coming along with this, then it would start off a new perspective when it comes to youth engagement in health. Now, the other thing is also coming in through the technology, telemedicine. I keep saying telemedicine because it's one way to go. If we have doctors, if we have health professionals, nurses interacting directly with the public, you realize that we'll be able to deal with the issues of non-adherence to treatment. We'll be able to deal with non-compliance, and then we'll be able to deal with some of the myths that exist with health. You realize that people don't have the real information. You come to Ghana, my country, and someone has a herbal medicine, and then he's saying a lot about the herbal medicine, and the population tend to believe that. And they take it. And that's some of the causes. Now, it's the number 3 cause when it comes to kidney failure in Ghana. Liver disease is herbal medicine. But we don't tend to look at how we can curb these insurgents in our systems. We allow them to perpetrate the same thing, and people are dying out of it. So let's come to medical voluntarism. Let the youth, let's rally together. Let's get the right information, and let's push the right information to our people. And there we'll start off the basics that we missed in the beginning.
Thank you. I think I heard a lot about information and literacy. So just a reminder for all of you who are joining us on Zoom and Facebook, please put your comments and questions in the chat box, and we'll get to you very shortly. So the last question I have before we open it up to questions is, how can decision makers in Africa disseminate public health guidance more widely?
I believe they could first of all start from the schools, as I mentioned earlier. The children, if you teach the children whilst they are young, it will stay with them. Teach them how to, with this washing of hands that it came down to, how to wash their hands, healthy ways of living, how to prevent the basic diseases. We can, apart from that, they can, I also mentioned that they can use the mass media. Leverage social media. And they can also collaborate with the telecommunication companies. We all know every day you get at least one message from your telecommunication provider. They'll send you a message, be reminded, Vodafone Cash, MTN Mobile Money, they keep sending you notifications. But why doesn't the government collaborate with these telecommunication companies to send out information in terms of when there are emergency situations? So yeah, the government, the people in charge can collaborate with these companies to send out relevant information, especially when it is an emergency situation.
Okay, so I believe, let's go back to the top, the policies. Now, the policies have to be practical. When we are bringing up a policy, let's make it practical. We have an African health strategy. We have an African CDC. Now AFCFTA is about to roll out. We can combine all these things and put a bigger cap when it comes to health. Let's start with the policies. Let African CDC implement all the strategies and the targets they had. The development of the regional biosafety labs, the decentralization process. Let's do that. When we come to the national setting, let's advocate for universal health coverage. Everybody needs a health insurance. And it is no longer a privilege, it should be a right to everybody to have health insurance. And that is what our government and our stakeholders or leaders are not taking into account. Ghana, we have a health insurance, but it is very, very minimal when it comes to the scope of disease cover. Let's look at how to expand these things. Let's look at other countries in Africa who don't have access to healthcare. Let the governing board, the AU, all of them, let's come together and fight these things. And then when we come to our local level, let's look at the disease prevention. Prevention is better than cure. Let's look at how to prevent diseases, and let's promote primary health care when it comes to Africa. That is one thing that countries have done, and it's been able to work for them. I can speak boldly of a country like Cuba, a small island country, being under economic blockade for more than 50 years. But they've been able to develop a more resilient healthcare system. Mm-hmm. They've been able to do that, all because of primary health care and prevention of diseases. Let's model some of these people. Let's model them. And when we bring a policy, let's make sure it works. And youth, we should also be on guard and make sure that we hold them accountable for all the things they are supposed to do. And in doing that, let's also play our role. Thank you.
So, under the context of health care funding, I just wanted to say that the national health insurance may have need to be reviewed to cover more preventive health services, because you realize that screening for cervical cancer may not be covered, but treatment for cervical cancer is covered, which does not really make sense, because we could prevent a great majority of persons from getting the disease as opposed to managing the disease, because sometimes it may be so advanced and incurable. So that's one aspect we should look at, making it more practical and more preventive. Yeah.
Thank you. So now I'm going to open it up to questions from all of you here in the room with us today. Does anyone have any questions for our panelists? Okay. So I saw the gentleman's hand first. He's coming with the mic.
Thank you very much, our speakers. Thank you very much, Dr. Samuel. So I would like to ask these three questions. Number one, what is the role of artificial intelligence in medicine? And how best can this telemedicine, you've been emphasizing, be effected in low-income communities with no access to internet or mobile phones? So we understand that there are some communities that have access, they don't have access to internet and mobile phones. So how will they, harness these telemedicine opportunities? And also, what is your take on mobile clinics? Then lastly, how has poor refereeism of healthcare professionals affected the healthcare system? So we understand that majority of these healthcare professionals, finish medicine in either Ghana or Nigeria, then, go to United Kingdom or Canada or US to practice. So it's just like these low-income countries, are, breeding medical doctors, and, they are taking these skills and this knowledge outside the country to get a better living for themselves or a better pay. Thank you very much, sirs.
Okay, thank you so much for your question. Now, the first one, artificial intelligence, it has come to stay. We need to know that in all the sectors, when it comes to the economy, from business, from law, artificial intelligence is playing a key role. Now, when you get to medicine, we equally use it. Now, one thing we do is that we do a 3D surgical test. For example, if I want to go and operate on a patient, I'll go and first perform the surgery 3D, make sure that I have everything right before I put the patient on the table. And that's what the developed countries are practicing. Artificial intelligence is automatically helping to diagnose patients, because when you sum up all the symptoms and the signs the patient has, it gives you a probable disease the patient has. So you realize that it makes the work of the medical professional much easier and to be able to intervene more adequately. Now, if we bring in a more sophisticated diagnostics through artificial intelligence, it is equally going to help our health systems. So what we need to do is to make sure that we're able to get this technology, bring it down here, train the necessary human resource to be able to use this to a benefit. And I believe that we can do that. There's nothing impossible. We can do that. Now, on the telemedicine, let me talk about one of them where I actually work. What we do is that with a mobile phone, right, you call the health center, and then there you have a lot of doctors who speak multiple languages, both international and local dialect. It's been strategized in such a way that we will have at least representative from each part of the country on board at a specific time. So you just have to dial a cost-free number, and then it goes straight to the health center, and then you speak with the doctor. Now, you don't need internet to do that. You just need a mobile phone and a network. Now, on the other hand, mobile phone where patients don't have, that I cannot answer, because I think that comes more into personal and then financial and economical situation of the people. But we can look at international or stakeholder participations, provide access to mobile services to those people, engage the mobile phone networks to be able to extend their reach to those places. And then with just a dial of a number, I worked in the Vodafone Health line. You dial 255 and you speak with a doctor. You can dial now and you speak to a doctor. I'm very confident of that. And that was an initiative funded by Vantage Medical Services and Vodafone, a partnership with a telecom company. And this can be replicated in every part of Africa. I know Tanzania is doing the same and it's working. You speak to a doctor. In that way, we limit the outpatient visit to the hospital. In that sense, we are also preventing infection transmission at the level of the hospital. So telemedicine can work. Okay, so that is what I have to say with your question.
Concerning artificial intelligence and technology in medicine, I think that we have a lot of universities. We even have technical universities in the country. We have very smart students pursuing courses in technology in these universities. A major problem is funding, because at the end of the day, they all write their theses, they all do projects that, if well developed, can help in the health sector. But often they don't get the funding. Their idea is therefore sold to an international company which develops it and brings it out on the market. But the idea could have come from a very local university. So that's one thing the government needs to look at. Private sector needs to look at funding students in these technological institutions so that we can produce locally, because it may not be cost effective to import all these technological devices. So if we produce it locally, if we produce innovative technology that we now sell, or we now, have the rights to, then we even help with economical growth, which we can channel back into the health sector. So that's one thing that we need to look at. And I also wanted to comment on the brain drain situation you talked about, medics leaving the country to other countries. I don't think it's just medics. People in all fields of work, provided they have an opportunity to go elsewhere where the pay is better, they may go. So that's one thing. And another thing is that you go through medical education, you learn about the diagnostics available, therapeutic options available, and you finish and you just sit in the consulting room doing the same thing your grandparents did in the consulting room. It's a bit discouraging. So people tend to maybe want to go and further their education, but because they meet conditions that are better and more favorable, that help them to practice better, they tend to stay. So I wouldn't encourage that. I would urge those who have been able to go to maybe come back and improve the system, because, it's a way of learning. You go, you get the benefits of the education system there, or the professional system. You come and improve this so that others here may maintain the standards as it is internationally.
With regards to the brain drain, I believe one of the ways in which we could reduce its happening is investing in our healthcare system. A lot of the time, the medical professionals, the conditions in which they are working are not favorable. So they go on Facebook, they look at their friend working in Texas, like, this person is having it good. Why don't I go to Texas and work with the person? So if government could invest in facility, provide good facilities for people to work in, give opportunities for people to specialize, to further their education. As she mentioned, most people go because they want to further their education. In Ghana, it was recently that the government decided that they are going to make it free to specialize. Even that one, the possibilities are not that many. There are lots of the specialties you can't do in Ghana. So if government could invest in our education and in facilities for healthcare workers, I believe it will go a long way to help prevent brain drain.
Thank you. I think there was a young lady at this table with a question.
Thank you very much for this opportunity. Greetings to the panel and all protocols duly observed. My question is, I've learned how important prevention and health literacy is key in our health status. But here's the case that we have lack of human resources. I think the panel made mention that there is lack of resources pertaining the Allied Health Center, and which we know that prevention is key in our health status, which the Allied Health are responsible and they embark on these cases to help educate the less privileged or the community about preventive measures and other stuffs. But here is the case that there is lack of these health allied professionals or students. My question is, how do we motivate young people to venture into this allied health sector? And then how do we motivate those into it, the professionals into it, in order to put their work into a higher esteem, to render their work into the fullest way? Now that I have heard that we have people going out to educate people using the media, we have the communities where they have less resources, they can access the media and all that. And then we have some allied health professionals who reach out there, but I have realized that they have less resources in embarking on these outreaches to educate people in the rural areas, in the communities and all that. How do we help cushion those people in order to embark on those that, so that it can also educate the people in the communities, not just some of us in the urban areas? Thank you.
Thank you.
So I think Samuel earlier on mentioned that the challenge of healthcare personnel population ratio is a real problem, and it wouldn't be solved in a day. It may not be solved in a year. So he advocated that normal people go into health advocacy by getting some health education from professionals. That doesn't mean that you're going to go to school to become an allied health personnel, but then you have acquired the relevant and appropriate information to disseminate. What we don't want is for people to disseminate false information. This misleads the public and then undermines the whole concept of preventive medicine. So we need people who come together. This is a health advocacy group. You invite an expert in this field. They give you the education. Then you go out there to educate people. I think that is one way where we could address the problem of not having enough personnel to provide education. Now, the telemedicine that has been spoken about, yes, individuals may not have mobile phones, but if we ensure that at least the healthcare facility has access to a mobile phone, that the nurse there, the physician assistant there, or the doctor there can communicate with doctors in more advanced or higher level healthcare facilities and provide the same quality of healthcare or adhere to the correct referral system, so that those who are there in the rural areas cannot get access to the care that they need, may be sent to the appropriate centers to receive the care. Until we get to the point where there's equitable distribution of healthcare infrastructure and personnel, I think those are some of the things we may have to do.
Thank you. I think there was another question from this table on this, and then we'll go to that side.
My name is Gertrude from Don Bosco. Thanks for giving me the opportunity to ask some questions. And my question is, children who are not educated or children who don't have phones or laptop, how are they going to get access to the internet or the social media?
Okay, the health literacy we've been talking about, in as much as we are trying to leverage social media, to the internet and social media to promote health literacy, the basic is in the grassroots. We have to emphasize on grassroots participation. We are trying to use the schools. You mentioned people who are not in school. So for people who are not in school, we are encouraging the youth We are encouraging people to come together and go out to the communities, educate people, teach people how to prevent the basic diseases, the transmittable diseases like malaria, typhoid, cholera, non-communicable diseases like hypertension, diabetes. We're encouraging everybody here to join organizations who are promoting health literacy. So they can go into the communities and do this educational, and for children who are fortunate enough to be in school, basic education is actually free in Ghana. So ideally, every child is supposed to be in school. So for people who are in school, we are trying to revise the educational curriculum to include health literacy, teach people about the basics in the basics about most of the important diseases we have in Ghana and in other parts of Africa.
I just want to buttress a point that it is pathetic that in the 21st century we are talking about people not being in school like it's a normal thing and something that should be accepted. Like she said, basic education has now been made free. If you have people who are not in school because of personal or family or social problems, there are various avenues that you could report the situation to so that they look into it. Because formal education is important for all aspects of development. It is important. Even if you are going to go into the informal sector, some formal education, even at the basic level, is very relevant to your success. So let us also put the word out there, encouraging adults to allow their children to go to school. I think that's also one thing, because if they go to school, and a lot of these basic preventive health issues are actually taught in school, because I recall that I had some education about health prevention and protection, how to prevent malaria, parasite from the mosquito from breeding and all that. They're actually taught in schools. So I think we should also encourage the masses to take advantage of the free education system and then get some form of education.
Okay, thank you. For time purposes, I'm going to take the last two questions from this side of the room. So please, just one question. Thank you.
Yeah. Thank you very much. I'm Grace Tetefi from Buck Africa. Please, my question is that most herbalists in Ghana are producing medicines that they claim have been vetted and approved by the FDA. But I want to know how the formal sectors have to collaborate, or how they are collaborating with the herbal sectors to cure some diseases that they claim they have cured, but there are other formal health sectors who say they are managing. Thank you very much.
So let's get the next question and the ones together. I think there's a young lady raising her hand. Yes.
Josephine, I'm from IMID. I've been hearing a lot about how we can make health services accessible to all, especially those who are not literate, how they can get access to medical doctors on phones and all those things. But have we been able to look at the psychological aspect of these people? We're only talking about like the allied health services those people are going to get. So how can we coordinate or work with psychologists, mental health workers, public health sector, social workers? Because we see that these are mostly the people who are on ground. We have the medical doctors, the nurses always in the hospital, because that's where they are being treated. So how best are we going to coordinate with psychologists and other social workers in the community to start there? Because when the mental health status or the mindset of these youths are well educated, they can know how best to handle these health issues, what is necessary, where to start from, and take it from there. Please, how can we address these issues?
Thank you. Please, she's raising her hand. Let's get that question and then we'll answer. Thank you.
You asked the question of how are the youth going to get in touch with the leaders to come up with their, and I participated in one of these programs, the hackathon program. We were asked to come up with a solution to enhance students' life from home. And because I am an advocate for children with disability, I decided to come up with parent guide plan for parents with autism spectrum disorder children. Because in Ghana, you hardly see us campaigning or educating parents with such children. I came up with a very good plan, but here is the case. They were like, we don't have, your project will not fetch us money. Sometimes we have the solution, but our leaders are not willing to invest in our project because they are not going to get anything from it. So in this case, how are we going to, solve problems? We have a lot of problems that we need to solve, especially when it comes to disability education. In Ghana, for instance, we don't have about even
So please, sorry for time. Can you get straight to the question?
So what I want to ask is, how can we come out, or how can we solve this kind of problems when our leaders are not willing to help us?
Okay, great. So do you all remember, I forgot the first question. The second question was inclusion of mental health, and her question is, how can young people work with leaders when they're not motivated?
Okay, so for the herbal medicine, one thing we have is we have an organization called GAFTRAM. GAFTRAM is a group of herbal medicine producers in Ghana, and they are affiliated to the Center for Scientific Research into Plant Medicine at Mampong. So these bodies are supposed to regulate the herbal medicine treatment protocols we have. Now, the sad news is that some of these herbal doctors don't go through the process, and that is what makes it difficult. So now they are trying to build a more stringent regulatory measures, and I think that in the coming years or weeks or months, we might have some of these things coming into play. So let's also tell the herbal doctors to approach these bodies before they roll out, and then we just need a regulatory measure, and that would solve the issue. Now, in the other case of the psychology, I remember in our telemedicine, our health center, we have a list, we're provided with a list of psychologists, clinical psychologists and psychiatrists, that if I assess a patient and I know this patient needs an intervention from a psychologist, I quickly refer the patient to that psychologist. The psychologist will equally call the patient, and then they were positioned in vantage positions around the regions, which could also lead to further follow-up cases. So that was one thing that was implemented in the COVID era, and I think we can replicate it going forward more into other parts when it comes to healthcare. And equally, we need community engagement and inclusion when it comes to social workers, and that's what we need our Ministry of Interior. Our ministries of Interior need to come up with policies that really tackle this matter, because social welfare is under Ministry of Interior. Now, for the last one, I think the issue is that we sometimes don't approach the right bodies. You had a good plan to be able to do education in autism, but I would tell you that write a good proposal. A good proposal, and don't only take it to one body, but take it to a lot of the regulatory bodies, and also to the corporate society, because there are organizations or companies who really sponsor your idea and push it much further. Right. Sometimes we go alone, and that's what gives us that hurdle. And this is one thing I advocate for the leaders and the organizers of the summit, that we need to take up and look at key measures we can put in place so that policies and agreements we have here can be implemented. So our advice, write a good proposal, bring it across, and then let people or other health workers, let us push it to the right sources, the right offices. And I think we can be able to have an answer to yours. Thank you.
Thank you, Dr. Ofosu-Agamat. So we're just going to go into your closing statements because we need to close this. So please give us your closing statements, and I'll start with you, Dr. Florence Akumiya.
So I'll just want to say that the COVID pandemic has unveiled a lot of deficiencies in our healthcare system. We've spoken about a lot of them here. I want us to leave here today motivated to look at ways to solve these problems so that if there should be another pandemic or in our delivery of everyday healthcare service, we have the capacity to do so. Thank you.
Okay, I'd like to say that this year, 2020, the COVID-19 evolved from an isolated case in Wuhan, China, and to being declared as a pandemic on the 11th of March. It affected a lot of sectors, from education. It caused countries to go into lockdowns. People had to, and a lot of people suffered. But arguably, the healthcare sector has been the most affected, and it has exposed a lot of deficiencies in our system, from inadequate personal protective gear to inadequate medications to lack of, and generally shown us that we are not prepared for any health emergencies. And so going forward, the question is, what can we, the youth, do to find sustainable ways of development? How can we, our goal is to find innovative ways to prevent diseases, to prolong life, and to promote health now, whilst ensuring that it continues progressively for future generations. So I would like to encourage each and every one of us that these kinds of programs are where we meet like-minded young people, exchange ideas for development. So I encourage each and every one of you to participate, bring your ideas together, and together we can find ways of ensuring sustainable development. Thank you.
Okay, so in my closing statement, I'll say that COVID-19 has come to press the reset button. The reset button where we need to go back and review our basics and do things right when it comes to healthcare, medicine, and prevention. And this is where I think the youth, okay, especially the leaders, National Youth Authority, the Youth Advocate Ghana, we all need to stand to our feet. If the youth, let's do what is due us first. What we can do, let's do that. Then we can now put pressure on our stakeholders and government to also complete the process so that we can have a more dynamic society. So I think that the time is now for the youth. Let's rise up and stand to the occasion so that we can make our societies much better than we met it. Thank you.
Thank you all. Can we give a round of applause to our panelists?